Around the world, the World Health Organization estimate that 3 billion people use solid fuels such as charcoal or wood to meet their basic energy needs. The smoke that these solid fuels produce result in lung cancer, chronic obstructive pulmonary disease, ischemic heart disease, stroke disease, and pneumonias, particularly in children. And these diseases globally in 2012 are estimated to have killed 4.3 million people. We know within Cambodia that 90% of rural Cambodians rely on solid fuel for cooking. In the same year, we had an estimated 4,000 cases of respiratory illness in our health centre. Locally and globally, this is an enormous problem. I've just started a fire to boil this kettle, and it's been going for about 3 minutes. And these are exactly the kind of conditions that people will cook under for. Women will cook on this for up to 6 hours a day. Breathing in all this smoke, and this is only just getting going. This will get much worse as time goes on. Breathing in smoke like this that is causing pneumonias with children, and lung cancers and chronic obstructive pulmonary disease and problems like that. My project is looking at household air pollution and the healthcare burdens that are arising from cooking solid fuels indoors. This reaches out to the women in Sandlot because 99% of the cooks here are women. It empowers women to do something to change their own healthcare and that of their children. It has a very direct link to the environment, and it's the cutting down of trees and provision of solid fuels that is driving this healthcare problem, and we need to attack both at the same time. I've worked closely with the healthcare staff in the healthcare centre to both educate them about the problem, but also develop their non-clinical skills and encourage them to become educators of the people themselves, so that the sustainable link is put in place. The key is the villagers and the very people we're trying to help, all of whom are understanding more and more the healthcare burden that cooking inside with solid fuel is placing upon them and their families. And it's only by changing attitudes at the grassroots level within the villages that I think we will see a real drive in the rural regions to change practice. Working within the healthcare department of MJP would be impossible without the help of our Cambodian colleagues within the healthcare team. They are the real drivers in this community and getting these projects set up. Without them, nothing would ever be achieved here.